All right. Hello, everybody. My name is Haley Buckner, and I'm with Elevate Oral Care. I'm going to walk you guys through this presentation today here on silver diamine fluoride. And before we begin, I'll just really quickly introduce you guys to Elevate Oral Care since we're still a pretty new company here and not everyone is too familiar with us yet. But if you have been practicing for a while, you probably remember Omni Oral Pharmaceuticals that used to be around. And they were pretty big leaders in the dental prevention world for a long time. They were the first people to launch the first unit dose fluoride varnish here in the United States, and it was called Cavity Shield. They then improved upon that and brought forward the first white varnish, which is called Vanish Varnish. They launched a lot of other products in their time with Omni that are still being used today, like Periomid, the first stannous fluoride rinse. But anyway, the owners of our company actually used to own Omni. They ended up selling it to 3M back in 2006 and have since come back as Elevate Oral Care. So we could bring forward other preventive care products like silver diamine fluoride. And we do have a full line of preventive care products here at Elevate, all with pretty unique formulations. We truly don't launch a product unless it's really going to set itself apart from other products that are on the market. So for example, we do have a fluoride varnish. It's called Fluoramax. It's a very unique formulation. It's actually the first and only 2.5% sodium fluoride varnish on the market. It's a very quick drying, very thin fluoride varnish, and it does have that half the concentration of traditional varnish. We also have a great dry mouth spray. It's all day dry mouth spray. It's also has a 44% xylitol in it, so it's a really neat product as well. So at the end here, I'll pop up a slide so you guys can see some of the other products we do have, but we'll jump right in here to silver diamine fluoride now. And before we begin, I just like to show this slide because silver diamine fluoride is really different than what we're used to using in dentistry. So it's one of those products where you kind of want to think outside of the box with it and go outside of your comfort zone because as you can see here, that's really where the magic happens. So that's just kind of a fun little reminder before we get started here with silver diamine fluoride. And a quick little history lesson here. You can see these girls. This is something that was considered really a rite of passage for women, mainly in Japan. When they got married and had children, they eventually did this discoloration of the teeth that caused that black discoloration. And that happened really all the way up until the early 1900s. But the most interesting thing about that is these women were not developing tooth decay. So that's an interesting thing to point out here. And then that kind of brings us right here to Dr. Nishino. And she was discovering that these women were not developing tooth decay. And so with that, she started doing some research, and really all of the original research on silver diamine fluoride could be credited here to Dr. Nishino. She was the first one to develop the first formulation of silver diamine fluoride. So we'll go into a little more history here on silver diamine fluoride. So it is a pretty new product here in the United States. It launched here in April of 2015, but as you can see on the screen here, in that short time, we've made the cover of multiple different journal articles. Even though it's pretty new here, though, other countries have been using silver diamine fluoride for several decades. I know Japan, for example, has been using it for over 80 years, and in that 80 years, there has not been a single adverse event reported. So it's also an extremely safe product to use. And it can be used in all age groups, really for a number of different things. You can use it to treat and prevent hypersensitivity. You can use it to arrest caries, which is really the most common use for it. It can be placed right around existing restorations if you have a patient developing any recurrent decay. It can be used under new restorations as a liner and even as an occlusal barrier like a sealant. So there's lots of great uses for it. And here's what the product looks like. Since we've been on the market, we've had this 8 milliliter bottle, which is really the bulk option for it. So that 8 milliliter bottle has about 250 drops, and each drop will treat up to about 5 teeth. So a little goes a long way with it. And then we recently launched our little single-use unit dose ampule that you can see on the right here. And you can see there's about a 0.1 milliliter in there. So that's equivalent to a couple drops of silver diamine fluoride. So there's plenty in each little ampule to treat whatever that patient might have going on. Depending on the product you use, the product might have a slight blue tint with it, which comes from the the 8 milliliter bottle. When you dispense that, it does have a light blue tint to it. the product in the unit dose sample is still a clear solution, but it is just a very thin substance. It has the consistency of water. It does smell a bit like Windex, but you use such a small amount that patients really won't notice that Windex smell. The only thing they will notice is just a little bit of a metallic taste, and that's really just from the silver component. And as you can see up here on the screen, it is a 38% solution. So the rest of it is just all water, but that 38% breaks down to 25% silver, 8% ammonia, and 5% fluoride. And throughout the presentation, we'll go into detail about what the silver and fluoride's jobs are. But just so you know, the ammonia is in there just to stabilize the silver and fluoride in the concentration together. So silver diamine fluoride is FDA cleared as a dental hypersensitivity treatment, which is really the same way that fluoride varnishes are cleared. So if you read through the package insert that comes with the product, just know that the entire write-up on that package insert will be completely around our FDA clearance of that dental hypersensitivity treatment. So it says a couple of things on there that will actually contradict what I'm going to tell you guys today. For example, right on that package insert, it says that this is for use in adults over the age of 21. And that's just because those particular studies that we used to get our FDA clearance were done in patients over the age of 21. But it is completely safe and acceptable for this to be used in any age patient. And we'll go through toxicity and all that stuff so you guys feel completely safe and comfortable using it that way. And I like to point out, too, that the FDA recently awarded us what's known as a breakthrough therapy designation. It's actually the first oral product to ever receive that from the FDA. And that's really the FDA's way of letting you know that they understand the product is currently cleared as a hypersensitivity treatment, but they're definitely seeing the benefit of using this to arrest caries. So that can kind of help ease your mind in using it that way as well. And as you can see here, this slide goes into pretty great detail on how the product works. But really, just to kind of sum it up, the silver component is the antimicrobial agent. So that's what's actually killing off the bacteria in those lesions. And it also helps to prevent the formation of new biofilm throughout the entire dentition. And the fluoride's job is to promote remineralization in the tooth that you're applying it to. And it too helps to prevent demineralization throughout the entire dentition. And we'll go into that full mouth benefit a little bit further here in a couple of slides. But on this slide, I do like to point out the bottom bullet point. And you can see it says that silver and fluoride ions penetrate about 25 microns into enamel. And depending on what study you read, that should really actually say about 50 to up to about 300 microns into dentin. And that's in healthy tooth structure. So as you can imagine, if you're applying this on those demineralized tooth surfaces, those silver and fluoride ions will definitely be able to penetrate much deeper than that. And as I was saying in the beginning, this is a very safe product to use. There's a very large margin of safety with it. So much so that toxicity is just really nothing to be worried about with it. And I like to quote one of the research articles here, and this actually came out of the California Dental Association Journal in January of last year, so January 2016. And this is an article out of UCSF. And it stated that assuming the smallest child with caries would be in the range of about 10 kilograms, about a 22-pound patient, the dose would be 0.95 milligrams per kilogram, meaning the safety margin of using an entire drop on this patient is 380 milligrams per kilogram. So it equals a 400-fold safety margin. And this graph does a great job kind of explaining the fluoride content in silver diamine fluoride versus traditional fluoride varnish on the market. So when you break it down, you can see on the right here the milligram per dose. And you can see the silver diamine fluoride is at 1.12 milligrams per dose. And for the fluoride varnish, depending on the unit dose size you're using, you can see on the right there. So as you can see, it says at the bottom here, in short, 1 drop of silver diamine fluoride has the same amount of fluoride as 1 liter of properly fluoridated water, which shows you that right there. And to go into explaining the silver on that, so that 1 drop has about a tenth of the amount of fluoride that a traditional fluoride varnish has, and it is 400 times under the EPA's ingestible limit on silver. So again, it is a very safe product to use. And the application with it is very simple as well. So we just recommend isolating the area with cotton rolls, and then you want to dry the area, and you'll use a little applicator brush and you'll just coat the surface of the lesion. And you want to let it soak into the lesion for about a minute. And then after that, you're just going to quickly coat a fluoride varnish over that. And the addition of the fluoride varnish over that is kind of one of the new additions to the application, but we recommend that now because we're finding that by coating that fluoride varnish over it, it kind of helps to leave that area undisturbed and let those silver and fluoride ions penetrate deeper into that lesion. So just a quick coating of a fluoride varnish. And you do want a quick drying varnish over it. And that's where Fluormax varnish comes in very well. It's a very fast drying fluoride varnish, very thin, and it also has half the concentration of traditional fluoride. So it's a great fluoride varnish to quickly coat right over this. And I see that a question came in. Do we need to light cure it? That's a great question, and we actually get asked that a lot, and the answer actually is no. You really do not ever really want to light cure over silver diamine fluoride. There's only one instance where we do recommend light curing over that, and we'll get into that more, but that's only if you're going to be placing any kind of a light cured restorative material over it on the same visit. That's the only time. Otherwise, we do not recommend light curing over it. So after you apply it, there's really no aftercare instructions or limitations. So patients can eat or drink right away. They can brush, rinse. They can really do anything they need to over it immediately afterwards. Okay, and there's a question that comes in here, and it's asking about if there's research on the benefit of placing varnish over the silver diamine fluoride, and the answer is no. It is just clinical perception right now. So really that's just the feedback from the field and what we are finding to now be the best way of treating treating that area. So doing the silver diamine fluoride, letting it soak in for that full minute if you can, and then quickly coating your fluoride varnish over it. So this is definitely a great slide to go through, because if you have really heard or read much about silver diamine fluoride, oftentimes one of the first things that comes up is the staining. So I definitely like to explain that in detail here. And the bottom line is you do want to be very careful when you're using silver diamine fluoride, because due to the silver in it, it will pretty much stain anything it touches except for sound, enamel, or dentin. So sound tooth structure is really just about the only thing this will not stain. So when you're applying it to that tooth, the only area that is going to stain is where that demineralized area is, or that bacterial infection in that tooth that you're applying it to. So really, in a way, you can view that staining as a positive, though, because once you see that staining take place, that is your feedback that that lesion is arrested. So that's certainly a good thing to see. And just know, too, that if it does happen to get on any of that surrounding soft tissue, it will cause a temporary soft tissue discoloration in the area. Usually goes away very quickly in about 3 to 4 days, but research will tell you that it can last up to about 2 weeks. So just be aware of that. And you can always use Vaseline on that surrounding soft tissue to prevent that from happening. But again, if it does get on that soft tissue, it causes that just temporary discoloration for a few days, and it really causes no other issues to that soft tissue other than that little bit of a discoloration. So with all that being said, it's a good idea to use an informed consent form with this product, because you do want to make sure the patient understands that staining that will take place in the tooth surface, as well as that possible soft tissue discoloration that can take place for a few days as well. And at Elevate Oral Care, we always have examples of informed consent forms, so you're welcome to reach out to us at any time to get some of those examples. Okay, there's a question that says, if you don't apply varnish over the SDF, will tissue still stain afterwards? So the fluoride varnish doesn't have anything to do with the soft tissue discoloring, really. I mean, it kind of might have that to prevent some of it from getting on the soft tissue, but really you just kind of want to isolate the area with that cotton roll. That's going to be your best bet at preventing it, or applying, like I said, a Vaseline on that soft tissue. So that's your best bet at preventing the soft tissue discoloration from happening, but it's certainly again, doesn't cause any issues other than that little bit of a discoloration just for a few days. So it's nothing major to worry about if it does get on that soft tissue. Is it completely dry after 60 seconds? Not necessarily, and that's why we recommend just kind of, sometimes if it seems really wet still for some reason, you can just dry away that excess before you apply your fluoride varnish over it. So you would just kind of blot or wipe away any excess on that area. Now, if this happens to get on any operatory surfaces or things like that, it will cause a staining on those surfaces. So that's why you want to be very careful at really just preventing that from happening if possible. The new little unit dose ampule has really helped cut down on possible staining and such on countertops because it's hard for the product to spill out of there. You kind of run into an issue a little bit more with the 8 milliliter bottle because you just have to dispense that into a little Diamine dish. So just be aware of it. If you guys do see that you have dripped or spilled any on a countertop, if you catch it while it's still wet, you'll want to use an ammonia-based cleaner on it. So that would include like Windex or Lysol wipes. If it has dried, you can use bleach on it. And then also be sure to cover the patient's clothing with a bib because it will definitely stain clothing as well. And we really have not found much to get it out of clothing. So be very careful with it. Okay, another question came in that says, I heard that iodine helps remove the stain from the tissue. So actually you would not want to, you probably have heard about potassium iodide, and that can kind of help lighten the discoloration or that staining in the tooth. But that's not a permanent lightening of the stain, but it'll just kind of lighten it temporarily, but eventually it will again turn back to that dark black stain. But with that potassium iodide, you want to make sure to keep that away from soft tissue because it is caustic to soft tissue. So yes, some people are applying potassium iodide over silver diamine fluoride to help lighten that stain, but again, it doesn't do much because it's not a permanent lightening of that stain. So just be aware of that and then be very careful with it around the soft tissue. So I want to go back up here on the second bullet point really quick because it's important to point out that this is an incredible desensitizer as well, like we talked about in the very beginning. So if you do have any patients where they may have some exposed root surfaces and they've got some sensitivity, you can apply silver diamine fluoride to those sensitive areas and those patients will experience sensitivity relief really pretty much instantly. It works very well as a desensitizer. And as you can see on the second bullet point, if it's healthy tooth structure, it will not stain that area. So that too is a really great way to use it. So aesthetically, if that stain is an issue, this can be covered with glass ionomer or composite. As for bond strength, silver diamine fluoride actually improves the bond strength with glass ionomer, and it does not affect composite bond strength one way or the other. So you can place either of them over it, like we talked about. But if you hold off on placing a restoration over silver diamine fluoride, it actually offers a pretty incredible full mouth benefit to that patient as well. And I kind of briefly described it earlier, but I want to go into a little bit more detail about that full mouth benefit that this does offer. So basically what happens is when you're applying this to those carious lesions, the silver, like we talked about, is the antimicrobial agent. So that's going to kill off the bacteria in those lesions. And that causes that dead bacteria to be added to the living bacteria in the mouth, and that silver will continue to be reactivated. So basically, the dead bacteria is going around killing off the living bacteria, and the research actually refers to it as a zombie effect or a reservoir effect because of that. And that same article I mentioned earlier out of the California Dental Association journal, they have a whole section of the article that's dedicated to the caries prevention that's seen from the product. And the article stated that annual application of silver diamine fluoride prevented many more carious lesions than 4 times per year fluoride varnish in both children and the elderly. So if you can just even picture that for a second, you'll have that little stained, arrested lesion in that patient's mouth, and it's going to sit there and act as a reservoir of that silver and fluoride where it's going to continue to offer that prevention throughout the entire dentition, more so than treating that patient with 4 fluoride varnish treatments in a year. So really the prevention that's seen from this is really just as incredible as the fact that it's actually arresting those lesions as well. Okay, another question just came in. So when you place varnish over the SDF, is the patient going to get too much fluoride? And no, absolutely not. And that goes back to, I can jump back a few slides here to show you, and just a reminder. So no, that 1 drop of silver diamine fluoride, so again, that treats up to about 5 lesions or so. And there's no way that patient is even ever going to be ingesting that entire drop because a lot of it's getting taken up into the tooth and such. So there's a very, very small amount of fluoride that they will be getting just from the silver diamine fluoride. As we talked about, it's about 1/10 of the amount of traditional fluoride varnish if they were to even to consume that entire drop, which isn't likely. So there's that. And then also when you place your traditional fluoride varnish over it for that coating, again, you're using just a very small amount. And so this is showing the amounts if you were to use the entire either drop or entire unit dose of that fluoride varnish. But of course, if that is a concern, that again is where I really recommend the Fluoramax varnish over it, because this is all with a 5%. So the Fluoramax varnish is a 2.5% sodium fluoride varnish. So it's even that much safer to apply that fluoride varnish over the silver diamine fluoride. Okay, so when you're not going to be restoring over, you can see down here on this 4th bullet point that silver diamine fluoride can be reapplied at intervals of greater than 1 week, and 1 application is normally sufficient. So our data tells us that about 75% of lesions are arrested with just 1 application, and then greater than 95% are arrested with 2 applications. So we've gotten a lot of feedback that offices will bring that patient back in about 2 weeks or so after the initial application, and that really kind of just allows you to evaluate it and make sure that it's done its job. And the 2 things you want to be looking for at that follow-up visit are, 1, did the staining take place? And 2, does that tooth surface no longer have that soft, leathery feel? And those are the 2 ways to know that that lesion is arrested. So at that follow-up visit, if you're not seeing those 2 things, then that's your feedback that you do need to reapply. And also, if you have any doubts at that follow-up visit, it certainly won't hurt to reapply as well, because we know that toxicity is nothing to be concerned about with it, and we have that greater than 95% chance of that area becoming arrested with that 2nd application. So it certainly won't hurt if you have any doubts. And then moving forward, once that area is arrested, it is recommended that you reapply the silver diamine fluoride every 6 months to a year onto that arrested lesion, either until you decide to restore over it or until that tooth exfoliates. And it's good to point out too that there is a 3-year shelf life on both the products, so 8 milliliter and the unit dose ampules. Okay, so good question too. Who is allowed to apply SDF? So from what we understand, anybody who can apply a fluoride varnish can apply silver diamine fluoride. And there are a couple of different billing codes that can be used with this. So really, anytime you're using this to arrest caries, you'll want to use this code you see in bold here, which is D1354. And you can see there it says that it is an interim application of a caries arresting medicament. So you can see here that was a brand new code just last year in 2016. So not everyone is covering it yet, but we've actually been pretty pleasantly surprised with the coverage we have seen so far. And I will point out too that D1354 code was recommended to all national Delta dental plans to have coverage on that starting in January of 2018. So we do expect the coverage to even greatly increase more in next year in 2018. There are a couple of other codes that can use it, or that you can use with it, excuse me. If you are using this as a desensitizer, you can use that 9910 code. And then 1208 can also be used because it is a fluoride application, so that certainly can be used as well. I see another question came through, does Medicaid cover? And that just depends on the state that you're in. But we do know that some Medicaid plans are covering it at this time. So, and we only continue to see that growth. So definitely check in with your state and see if that is something that they are covering. So I do like to point out, though, that silver diamine fluoride, we talked about the prevention that's seen from it. So it absolutely can be used as a prevention on healthy tooth surfaces as well. And we'll go through this a little further in a couple other slides here when we show you some examples. But you can really utilize silver diamine fluoride and a fluoride varnish on the same visit. And you can apply silver diamine fluoride to those high-risk areas. So if you have a patient with a lot of root exposure, we know that that area is much more likely to decay than the crown of a tooth. So you can absolutely apply silver diamine fluoride to any high-risk areas. And again, if it's healthy tooth structure, it will not stain. And then you can go in with your traditional fluoride varnish to those low-risk areas, just like buccal surfaces throughout. So again, I would recommend that the Fluoramax varnish because, again, it's half the concentration of fluoride varnish. So it's a great one to use in conjunction with the fluoride, the silver diamine fluoride. Yes, and Andrew pointed out watches and suspicious areas too. Certainly you can apply this on there. Now just beware that if there is actually an active infection there, it will definitely cause that area to stain just where the infection is, but absolutely. And that's a good thing to see again, because if there was something there, it's now arrested once you see that stain, so certainly. Okay, we're going to walk through some examples here and show some pictures. A great question too, Andrew, about using it for sealants. And I've got a slide here where we'll discuss that in just a couple of seconds. So absolutely, you can use this as an occlusal barrier, and we'll get right to that. This is a good slide to show, really just in case you've never seen what that staining looks like. This shows you a before and after, so you can really see the change. I like to point out, though, that the staining usually does take a good couple of hours to days for it to take place. So don't be surprised if right away that stain is not taking place. So if that patient leaves your chair and they still look like this picture on the left, don't be surprised. It usually does take a bit of time. But at the same time, don't be surprised if you do start to see some color change. It certainly can start taking place earlier. It is a light-sensitive product, so if there's some bright lights in the office and such, it certainly could start that color change, so don't be surprised. Okay, Andrea, so this is a great slide to go through with sealants here. Now, first of all, we'll talk about if a patient does have any little just decay in those deep pits and fissures, this is a great way to just to rest those areas in there without doing a full-on restoration to those areas. You can just apply this and it will just arrest where all those little pit and fissure decayed areas are in there. But two, like Andrew asked, absolutely it can be used as an occlusal barrier like a sealant. Now, in order for it to act as a true barrier, it does need to be reapplied every 6 months, but otherwise it works very well as an occlusal barrier as well. Another great way to incorporate silver diamine fluoride is by utilizing what's called a SMART technique. And if you even just go on the internet and start searching the SMART technique, you'll see lots of videos of this being done. But SMART just stands for Silver Modified Atraumatic Restorative Treatment. And it really allows you to arrest the area and restore it without the need for any local anesthetic or drilling whatsoever. So that's exactly what was done here in this picture. And so the SMART technique allows you to just apply that silver diamine fluoride in there, and you want to let it soak in again for a little bit of time, and then they just packed in like a self-cured glass ionomer to the area. And all that was done in one visit, and it usually maybe takes about 3.5 minutes when you watch these videos to see it all done from start to finish. And these young patients are easily able to sit through this. And again, no needle, no drilling. So it's a great way to incorporate silver diamine fluoride as well. Okay, another question came in about sealants. Then you put sealant material over it, just like a restoration. So let's jump back to that slide. Now, you have a couple options. You can use silver diamine fluoride as the occlusal barrier, so you would not need to place sealant material over it. Again, though, if you're going to use it that way, just be sure you're reapplying it every 6 months. Or you very well can apply sealant material over this. If you're going to do that, though, that again is one of those very few instances where we recommend light curing over the silver diamine fluoride first before you move forward with that sealant. And what the light cure step does is it's really not curing the product, but it is a light sensitive product, like I mentioned. So that light cure step will just speed up that reaction time, and it will help make sure that those silver ions won't get mixed into the sealant material and cause the whole sealant to stain when you go to light cure that. So anytime you're placing that light cured either restorative material or sealant over this on the same visit, then we'll go through that application really quick. So again, you're just going to isolate the area, dry it, apply this, and you really want to let it soak in for that full minute. Then you can just kind of blot or wipe any excess away, and then you'll pop your light cure over that silver diamine fluoride just for like a quick 2 to 3 seconds is all you need. And then from there you can move forward with either your restoration or your sealant. But again, that is the only time we recommend that light cure step. It's most beneficial to not light cure this at all. So you're only doing that to prevent that whole restoration or sealant from staining. This is a great example to talk through here. This is an example from Dr. Wren, and you can see there's a pretty large lesion over here on the left-hand side. In the center, there's that staining you want to see take place. And then Dr. Wren placed a product called Activa over it in the picture on the right. So for this particular tooth, this one was stable for about 4 to 5 months after the silver diamine fluoride was applied. Ultimately, this primary tooth did fail, but I like to show this one so we can explain how it does work in larger lesions like this. And it's really going to work in a combination of 2 ways. So one, those silver and fluoride ions penetrating deep enough within the lesion. And then 2, within just a couple of hours to really days after you apply this, the most superficial layers of that lesion will become arrested. And that's going to cut off the oral environment or that nutrition source for the bacteria that's still deep within the lesion. And then over the next couple weeks to even months, the remainder of that lesion will become arrested. And that's simply because that bacteria will no longer have its nutrition source. So like in this example here, it is just safe for us to assume that that bacteria got to the pulp before it was fully arrested. But that is how it will work in larger lesions like that. And this is another example from Dr. Wren. And this one is really just showing you a different way of how this can be used. And you can see over here on the left that they wanted to get a little bit better access to this lesion, so they went ahead and opened it up. There is still decay in here, so they're using that silver diamine fluoride to arrest the remaining infection. There's that staining that will take place. The bottom center is just with the tooth conditioner. And then again, Dr. Wren placed Activa over it in the picture on the bottom right. So this one was successful. And like I said, it's really just showing you a different way of how you can use it. And I like to point out, being as there is still decay in here, you can use silver diamine fluoride into and up to an indirect pulp cap. It only becomes contraindicated if you have pulp exposure on that tooth, because it would just be a little bit of an irritant to it. But otherwise, you can use this all the way up to that indirect pulp cap. This is a great slide too, because it shows you that this can be applied to interproximal surfaces with tight contacts like that. And I'll walk you through a video on how to do that. But I also like to show you what it looks like on those radiographs after the lesions are fully arrested. So it kind of looks like a scar on the radiographs. You might notice a slight increase in the radial opacity, but for the most part, it does still appear pretty radiolucent. So that's really just where documentation of the product is key. Just want to make sure you're documenting that you've arrested those lesions with silver diamine fluoride, and you're continuing to monitor and reapply when needed. Okay, a question came in that says, will this lesion still be arrested if you do not drill at all? In some cases, yes. Others, no. Depends on the size of the lesion. So, yep, exactly. So that's the neat thing with silver diamine fluoride is we have that research, like I said, about 75% of lesions are arrested with just that single application, and you don't always have to go in and drill. So it gives you the opportunity, if you've got a patient that is a difficult to treat patient, know that you don't have to go in and drill or remove any of that soft, mushy decay. You can apply silver diamine fluoride on there. It may take more than one application in certain larger lesions to arrest that area, but you don't have to if you have that difficult to treat patient. But it certainly isn't a bad idea if you can go in and remove some of that decay before you place the silver diamine fluoride. So it does just depend on the size of the lesion. So here's an example from Dr. Fricella, and this one shows you that this can definitely be used as the definitive treatment for a patient, which is exactly what the treatment plan was for this patient. And that's actually a great way to go. So if it is one of your high caries risk patient, it's very beneficial because, as you recall now, each of these little arrested lesions act as that little reservoir of that silver and fluoride, where it will offer that prevention throughout. So definitely not a bad way to go. And then, as we said before, you would want to make sure that you are still reapplying the silver diamine fluoride every 6 months to a year onto those arrested lesions. So here's another example from Dr. Fricella, and this one's an interesting one to talk through. So you can see over here on the left that this patient had some lesions right up front in that aesthetic zone, and a few days later, after that staining took full effect, this patient decided that he was no longer okay with how the staining looked, so he came back in for some restorative work. And you can see there's a bit of a halo effect around these restorations. So that could certainly be covered completely, but Dr. Fricella intentionally left that exposed, and that really, again, just goes back to that whole reservoir or zombie effect that this provides, and he feels it's beneficial not only for the patient's entire dentition, but also to prevent any recurrent decay now around those new restorations. So it's certainly not a necessary way of how you have to restore over, but again, it does just give light to how much of a benefit that reservoir effect is. Okay, so this video will walk you through how we recommend applying it to interproximal surfaces with tight contacts. And we just recommend using super floss or some kind of tufted floss where it has that thicker, spongy portion to it. And you just want to dry that interproximal area as best you can, thread the floss through, and leave the spongy portion on the lingual aspect. And you'll see here where they're going to apply the silver diamine fluoride right to the tufted portion of the floss. And you just want to let it soak in there, just about a 1/4 inch of that area. And then they'll use that as the applicator. So they're going to slide that through the interproximal and leave it between those teeth. And again, you want to let it soak into those lesions up to about that minute mark. And then after that, they'll just remove the floss, just kind of wipe any excess away, and that's it. And these are the applicator brushes that come included with the unit dose ampules. With that 8 milliliter bottle, these do just have to be purchased separately. And you can use any applicator brush you like, but these ones are really neat. This is a zoomed in picture, and it shows you these little grooves that the brush has, and it holds the silver diamine fluoride into those grooves through that capillary action until you dispense it onto or dap it onto the lesion. So it really helps to cut down on any dripping and then therefore staining of the product. And so this is the price breakdown, and this is the professional pricing for the 8 milliliter bottle. You can see that it's about $149 for the bottle. Again, there's about 250 drops, so that actually breaks down to about 52 to 60 cents for that drop. And then with one of those applicator brushes, it brings that total application cost to about 63 cents or so for that total application. And that, again, is the professional pricing. We, of course, do offer public health and government facilities do get a special discount. Okay, another question came through. Could a Tepe interproximal brush get in between? Oh, to do the interproximal application? It could, but some of those bristles would not really hold the liquid it wouldn't hold the silver diamine fluoride into those bristles as well. So the super floss is probably the best technique because it'll kind of just soaks it up in there and acts for a great little applicator to get in between those teeth. And here's the price breakdown for the little unit dose ampules. They come in kits of 30, and like I said, you get 30 of each size applicator brush included with it. And depending on how many kits you're buying, you can see the breakdown here, but it comes out to about $333 to $399 for each ampule. And again, that public health and government facilities do get a special discount as well on those. So just a couple questions to go over again, and just a reminder that if you're not restoring over, it is recommended that you reapply the silver diamine fluoride about every 6 months to a year. And then the two main contraindications to point out. So if that patient has a silver allergy, you would not want to use this on them. And you do want to verify that it is an actual true silver allergy, which really is not that common. That's really the only time you can't use it. And then also, you do not want to place this if there is pulp exposure. It is contraindicated. But of course, like we mentioned, it can be used all the way up to that indirect pulp cap. And there are no post-appointment limitations or instructions like we talked about. So that patient can eat or drink right away. They can brush, rinse. They can do anything. And then, again, we talked about that staining that will take place. So again, be very careful because it will definitely stain skin, countertops, instruments, clothing, all that good stuff. So be very careful when you're working with it. And we discussed what it looks like on those radiographs, and as well as the different billing codes that can be used. And we didn't really talk through it too much yet, but it absolutely can be used as a liner. I mean, if you think about the two properties with it, it's an antimicrobial and a strong desensitizer. So certainly after you prep that tooth, you can apply silver diamine fluoride in there. That way, if there is any infected tooth structure left, the silver diamine fluoride will arrest that remaining infection, and then it will also offer that desensitizing benefit underneath there as well. So certainly it can be used as a liner under those new restorations as well. And this is a little example of the instruction card that comes with the product. And specifically for those unit dose ampules, the two main things to point out is before you open it, you just want to make sure to tap the unit on the counter, get all the liquid to the bottom, and then use a little 2x2 to snap off the cap to prevent any little drops or splatters on a countertop, which again would stain. So that's really all I have on the silver diamine fluoride. I'll give it a second in case you guys need to type in any other questions that you might have. But as you can see, we do have that full line of preventive care products. So the products I mentioned are up here. So you can see our fluoride varnish in the upper right. We've got our all-day dry mouth spray that I mentioned. Great 5,000 parts per million toothpaste. So all sorts of unique preventive care products. A question came in about how well is insurance companies covering the 1354 code. And like I was saying, that was a brand new code just last year. So recently I heard that about 40% of insurance plans are covering it now. But again, it's not, it certainly is not something that you'll run in that everyone is covering it. But we have definitely seen reimbursement with it. And like I said, we expect that to grow a lot in 2018 with the national, the Delta Dental recommending them to be covering it as well. All right, so Elevate Oral Care is always more than happy to answer any questions. We have a great research packet put together on silver diamine fluoride too that we can always share, as well as examples of informed consent forms. So please don't ever hesitate to reach out with any questions. You can visit us on our website at elevateoralcare.com.